Okay, so preparation for end-stage kidney disease starts before your kidneys reach that 15% mark. Okay, so technically speaking, you actually start at start preparing in stage four. So stage five is when you really kind of get on dialysis. Stage four is when you really start preparing. You start to learn about your treatment options. If you haven't met with a nephrologist, you should definitely meet with one by stage four, the nephrologist and your kidney care team, and start planning for access. And whether that's fistula, early transplant evaluations, or a graft, these are things you can do whenever that EGFR is below 30. And so this is where you become your own advocate. We want to prepare early so you can continue to preserve kidney mass longer and delay the need for dialysis. And that's what this whole conversation's been about. And that's what this whole show and part of what technically speaking, because sometimes people are like, well, no one told me, or no one told me that my kidneys were decreasing, because a lot of times your clinician may not be aware, at least until recently, that you had kidney disease, because it used to be that your EGFR was not reported until it was less than 60. It was greater than 60, you just said greater than 60. And they didn't really give you a number. So like I said, recently they let you know, so you can tell the difference between when your kidney number is 80 versus 70. And so you can kind of watch it a little bit more there. And like I said, and now we can move into a world where we're preserving that kidney mass at, say, 55, as opposed to waiting until the kidney mass is at 30. We're moving in that direction. And that's one of the reasons why we want to empower you to know what's going on here. Okay. They have studies that show that when patients begin kidney education programs at stage four, okay, and that's the stage right before the dialysis stage, they can have 20 to 30% slower progression and fewer hospitalizations when they do start treatment. So if we start at stage four, that could be the difference between you having to go into the hospital to get started on dialysis versus you being able to go from your home or regular routine to starting dialysis, inside, even if it's inside a facility, you can get that done there. So knowledge isn't just about power; it's protecting you, it's protecting your kidney, it's protecting in some ways your way of life. Okay, so that you have fewer disruptions. Okay.